Welcome to the Brooklyn Hospital Prenatal Education, weeks 28 through 40, third trimester. Changes in the third trimester. Your belly continues to grow, and your belly button may pop out. You will continue to gain weight. Your ankles may swell if they have not yet, so always elevate your feet while sitting and in bed. Because of your growing belly, it may be harder to sleep, difficult to breathe. Hemorrhoids may develop. Hemorrhoids, which are swollen veins at the opening of your rectum that can become painful, itching, and may even bleed. This can happen if you strain during a bowel movement. Therefore, increase food and fiber and increase water to prevent constipation. Rest on your side, preferably your left side. Soak in a warm bath. Always avoid soaking in hot tubs or hot baths. Varicose veins, which are soft blue-colored bulges in your legs. Your growing uterus impacts circulation in your legs, so take breaks often. Wear maternity support pantyhose. Do not sit or stand in one position for too long, and avoid crossing your legs when you sit. So what's going on inside? Your baby's eyes are starting to open and close. Your baby may start sucking their thumb. Your baby can hear you talk, sense light, smell, and taste. Skin thickens and real hair begins to grow. The brain continues to develop. By 37 weeks, you are considered full term, and all vital organs are mature. Prenatal testing. RhoGAM. If you are Rh negative, at 28 weeks you will receive a RhoGAM injection, and again within 72 hours after delivery if baby is Rh positive. The reason is, if you are Rh negative and your baby is Rh positive, it can put your baby at risk for hemolytic disease. This is where blood can cross in utero, and your body will produce antibodies against the baby's red blood cells. By getting the RhoGAM injections, most times this is prevented. If you have to get RhoGAM, you will know ahead of time. At your initial prenatal visit, your providers will order for a type-in screen to be done. This will tell us your blood type and your Rh status. They will inform you if you need RhoGAM at 28 weeks. Group B strep testing, usually done at 36 weeks, is a swab of the vagina and rectum that tests for Group B streptococcus, which is a type of bacteria in the birth canal. It usually does not have any symptoms, but it could be harmful to baby during a vaginal birth. If you are GBS positive, you will receive IV antibiotics during labor. Sonograms. It is not uncommon to not have a sonogram in your third trimester. If there is some indication, your provider will decide if you need a growth sonogram, usually done at 32 weeks to check the growth of the baby, or NST-BPP. NST-BPP, called a non-stress test / biophysical profile, usually done after 32 weeks. The NST looks at your baby's heartbeat while they are resting and moving. If the heart rate goes up when they are moving, they are doing well. BPP assesses the fetal movements, breathing, muscle tone, and amount of amniotic fluid. It is then scored on a scale of 1 to 10. The score will help your provider see the overall health and well-being of your baby. Vaccines. Tdap vaccine is given between 27 and 36 weeks of pregnancy. This is given primarily for whooping cough. Whooping cough is a serious disease that can be deadly for infants. They are unable to get vaccinated until they are 2 months old. By getting the vaccine, you are passing antibodies to your baby before he or she is born. Your provider and close relatives who may help care for your newborn should also see to get their Tdap vaccine. For more information about the Tdap vaccine, ask your provider or go to the link below, cdc.gov/pregnant/mom/index.html. Warning signs. Preeclampsia. Preeclampsia is an emergency related to blood pressure. It can happen to any pregnant woman during the second half of pregnancy, up until 6 weeks postpartum. So it is very important to watch for these signs even after you have the baby. Signs include stomach pain, headaches, swelling of your hands and face, seeing spots, and gaining more than 5 pounds in a week. If you have any of these symptoms, come to Labor and Delivery Triage 3M for further evaluation. If you do not feel 10 kicks within a 2-hour period, having regular frequent contractions, so contractions that come every 5 to 10 minutes for a 2-hour period, any vaginal bleeding, leak or gush of fluid. If you are having these warning signs, please come to Labor and Delivery Triage 3M. Final weeks. Pack your hospital bag. Disability forms, ID, insurance card, sleepwear, underwear, baby clothes and blanket, comfortable bra, personal items such as toothbrush, toothpaste, lip balm, deodorant, list of medications you are taking, especially if you are delivering at a hospital where you have not had prenatal care, and a birth plan if you have one. Have your car seat. All newborns discharged from hospitals should be transported in a car seat. Practice installing the car seat before your baby comes home. Ensure that you have the basics: bottles, clothing, bathing, transportation, and baby furniture. Choose a pediatrician for your baby. We have a pediatrics clinic here at the Brooklyn Hospital. If you would like to meet ours, please ask us. For a virtual tour of our labor and delivery unit, go to www.tbh.org/obgyn/having-baby. Signs of labor. Bloody show, a blood-tinged or colored mucus. You may notice a bloody show during the last 2 weeks of pregnancy. This is a sign that your body is preparing for labor. If you have any bright red bleeding that looks like menstrual bleeding, come to Labor and Delivery 3M as soon as possible. Rupture of membranes. This is also known as your water breaking. You may have a small or large gush of water coming from your vagina. If this happens, come to Labor and Delivery 3M ASAP. Also, if you have rupture of membranes, note the color and the time. Contractions. Painful tightening of the uterus that can feel similar to menstrual cramps. You may also feel pain in your lower back as well. Contractions usually last about 20 to 45 seconds, and they come frequently and strong. Use your watch to time how far apart your contractions are. When you see that they are about 5 minutes apart, come to Labor and Delivery 3M. Stages of labor. Stage 1, which is the longest part of labor. Contractions begin and your cervix begins to dilate. Try breathing exercises and concentrate on relaxing between contractions. Pain medication may be given at this time. Stage 1 ends when your cervix is 10 centimeters dilated. Stage 2, cervix is fully dilated. Baby is moving further downward into the birth canal. You may feel the urge to push. Once you are 10 centimeters, you will begin to push and baby will be delivered. Stage 3, the afterbirth. After your baby is delivered, your uterus continues to contract and you will have to push to deliver the placenta. Cesarean delivery. In a cesarean birth, baby is delivered by making a surgical incision through your abdomen, oftentimes at the bikini line. Some reasons for a cesarean birth include having previous cesarean births, baby is not tolerating labor well, baby is in an abnormal position, baby's umbilical cord comes out first, placenta separates too early, or you have a specific medical condition or emergency. Newborn screening. Your baby will be screened after delivery. The scale used is called an APGAR scale, and it looks at appearance, how the baby's skin looks, pulse, the baby's heartbeat, grimace, the baby's reflexes and movements, activity, the baby's muscle tone, and respiration, the baby's breathing. This test is done 1 minute after the baby is born, and again 5 minutes later. A rating between 7 to 10 is considered normal. Baby has arrived. Do skin to skin with your baby. This is where you unwrap your baby and have him or her lie on your bare chest with only a blanket covering you both. Your partner can also do skin to skin with your baby. Skin to skin has many benefits. It soothes and calms both you and your baby, helps baby regulate their temperature, heart rate, breathing, and blood sugar, enhances bonding, and supports breastfeeding. It also helps your uterus contract. The first hour after birth. During the first hour after giving birth, your vitals will be monitored closely. Your uterus will be assessed by pressing on your abdomen. We want to make sure that it is firm. Your nurse or provider will massage your abdomen to keep it contracted. Postpartum checkup. It is extremely important that you come to your postpartum checkup for physical and emotional assessment. The drop in hormones after delivery can cause emotional changes and feelings of sadness, or depression. Although not uncommon, it is important to make your provider aware. If you had a vaginal delivery, your appointment will be scheduled 4 to 6 weeks after birth. If you had a cesarean section, you will have to return 1 to 2 weeks after birth for your wound check appointment, and then 4 to 6 weeks after birth for your postpartum appointment. These are 2 different appointments, and both are very important. During this visit, your provider will check your physical and emotional recovery from giving birth. You can discuss birth control options, breastfeeding, exercise, and sex at this visit. Were COVID-19 safe? Our hospital and staff work diligently to keep everyone COVID-19 safe by ensuring all hospital surfaces, including chairs, beds, and stretchers, are cleaned after each patient use. We have increased our hand sanitizing stations by more than double and utilize hand hygiene ambassadors to ensure we are all safe. For more information, you can follow the link below or go to youtube.com. Breastfeeding. How your body prepares to breastfeed. In your first trimester, your breasts begin to feel fuller and your nipples feel sore or tender. Your nipples and areola may get darker and larger, and small bumps around your areola become more noticeable. Starting around the 3rd month, hormones work as your body prepares for milk production. Glandular tissue, which is necessary to produce milk, replaces most of the fatty and supportive tissues in your breast. By the ending of your 2nd trimester, your body is fully capable of producing breast milk. After your placenta is delivered, your body sends signals to start the flow of breast milk. So what if I do not see breast milk while I am pregnant? Some moms notice yellow or orange stains on their bra. This is colostrum, the first milk produced. Do not be worried if your breasts are not leaking before the arrival of your baby. Colostrum, also known as the superfood for your newborn. Colostrum is the first milk your body produces. It is thick, sticky, concentrated milk and can be yellow, white, or clear. It is made up of antibodies, proteins, sugar, and fats. All infants benefit from colostrum, but premature infants who intake colostrum have significantly better health outcomes than those who do not. Benefits of colostrum: helps your baby build a strong immune system, creates a tough coating on your baby's stomach and intestines, acts as a natural laxative to help your baby pass meconium, which is the first dark poop, easy for your baby to digest, and helps prevent low blood sugar in infants and newborns. Health benefits of breastfeeding for mom: lowers the risk of osteoporosis later in life, lowers risk of cancers, breast, ovarian, uterine, and endometrial. The release of hormones helps your uterus contract, saves money on formula, saves time by not having to make warm and clean bottles, helps promote bonding, promotes earlier return of pre-pregnancy weight. Health benefits of breastfeeding for baby: provides optimal nutrition, provides safe, fresh milk, enhances the immune system, decreases the incidence and severity of ear infections, respiratory tract infections, and urinary tract infections, decreases the rate of asthma, childhood obesity, SIDS, which is sudden infant death syndrome, and rate of type 1 and type 2 diabetes. May be used to limit infant discomfort during procedures and inhibits tooth decay. The importance of a good latch and positioning. YouTube has very good videos on good latching and positioning. Also, WIC. Go to your local WIC office and speak with a peer counselor on breastfeeding so they can assist with good latch and positioning. You can also follow the links below. Different breastfeeding positions. The cradle hold, the cross cradle hold, the Australian hold, football hold, laid back position, and sideline position. For moms that had a C-section, usually the football hold or the sideline position is more comfortable. How often should I feed my baby? Follow your baby's hunger cues. Oftentimes, during the first 24 hours, baby will eat about every hour. After the second day, you may expect to feed 8 to 12 times in a 24-hour period. Remember, your baby's stomach is very small, so it cannot hold much. Watch your baby's wet and dry diapers. If you feel like baby's not getting enough milk or not wetting enough diapers, contact their pediatrician. Milk supply. By day 5, your mature milk has officially come in and you should have a steady supply. Breast milk production works by supply and demand. The more you feed and pump, the more you will make. If you want to build an excess supply, you should pump between feeds and store your milk properly. Ensure that you are staying hydrated. Proper hydration and nutrition is important when breastfeeding. Storing and thawing breast milk. Always clearly label the breast milk with the date it was expressed. Remember, first one in, first one out. Remember to never microwave breast milk. Microwaving can destroy the nutrients in breast milk and can burn the baby's mouth. There are several ways to thaw breast milk. In the refrigerator overnight, in a container with lukewarm water, or under running lukewarm water. Once breast milk is warmed, it should be used within 2 hours. Always remember to sanitize bottles before use. Pumping. At 36 weeks, your provider will send over a prescription for a breast pump. If by your 37th week you did not receive your pump by mail, please let one of the nurses know. Always wash your hands before pumping. Get comfortable. Make sure you have water, snacks, and entertainment so you do not have to interrupt your pumping session. And follow the instructions that come with your breast pump on how to use it. Some resources: CDC, La Leche League, AmericanPregnancy.org, and of course your WIC office. Thank you.